So this is a chapter on CPR, cardiopulmonary resuscitation. So what exactly is CPR? I kind of went over that. CPR is cardiopulmonary resuscitation. And this could be one of the techniques that's used when somebody has a heart attack, or again, they have cardiac arrest. So when does a heart attack occur? This is the question that's asked. So essentially, a heart attack occurs when the heart muscle tissue, okay, when cardiac muscle, it dies. And again, if you guys remember back to your physiology and your anatomy, heart muscle will die because the blood supply that's going to the heart, it's stopped or it's severely reduced. This will result no oxygen, the heart will cannot work. Remember, in order to generate ATP, adenosine triphosphate, one of the requirements is oxygen. It's needed. Also, your brain needs the oxygen as well. So, but again, we're not talking about brain right now. When there's no blood going to the brain, we call that a stroke. In the case of no blood going to the heart, it's what a heart attack is, or cardiac arrest. So again, cardiac arrest results when the heart stops beating. All right, and this is how we define clinical death. Clinically, somebody is defined to be dead when the heart ceases activity. So there's a chain of survival, okay? 5 events that have to occur very quickly in a short amount of time, and they have to occur in an integrated manner during that cardiac arrest. So first thing is you need to recognize that somebody's having a heart attack, and you have to activate the emergency response system, okay? So in Turkey, you call what? 112, all right? You see somebody that has a heart attack, you need to be able to know that they're having a heart attack, and then you need to call 112 because you need to transfer them to a medical facility as soon as possible. So once you do that, then you start high quality CPR, all right? After you do that, if there's a defibrillator that's available, we'll talk about that in the next lecture, then you use that. And hopefully by then, the ambulance comes in, or again, somebody that has more experience than you do, and they have more equipment and medications to administer to help save that person's life. Once that's done, they transfer that individual to the hospital, and the hospital has even more technology and medications available to support that individual. So again, advanced life support, okay? And post cardiac arrest care is provided at that point. So again, this needs to happen also. So these 5 things, depending what you have, again, notice they're all linked with one another. If all these things are met, then increasing the chance of survival, the chances of survival for that person rapidly raises, it goes up, it increases, okay? So the purpose of CPR is to move blood to the heart and brain by compressing the chest. So essentially what you're doing is you're doing chest compressions. So CPR provides both compressions as well as providing periodic breaths to place oxygen into that person's lungs, okay? So in terms of classification, there's some slight variations, and we have to know what age groups each one of them are. So anybody that is puberty, that hits puberty and older over that, they are classified as adults, okay? So puberty starts what, about 12 years, 13 years of age? That's when puberty hits, sometimes much earlier. But let's just say about 12, 13 years old, puberty occurs. So at that point, we say that that individual would be classified as an adult, okay? From age one all the way up to puberty, we call them a child, okay? Children are age 1 to puberty. And anybody younger than age 1 is defined as an infant, okay? This is age classification for CPR, all right? The next thing that we have over here would be, how do you figure out, how do you understand that somebody is having a heart attack? So first of all, if somebody's heart stops beating, they're not going to be responding to you, right? So, but then again, are they sleeping? That might be the case. So what do? You go and you tap that person, you try to wake them up. Are they asleep or not? Do they respond? So again, tap that person's on their shoulder and ask them, hey, are you okay? Are you okay? If that person doesn't respond, then we say that that person is unresponsive, okay? Another thing that's written over here is a sternal rub. So if you take 2 fingers and you rub the sternum, that's called a sternal rub. And by doing a sternal rub, it's a little bit uncomfortable and there's pressure there and might feel like burning. So that pain, it helps wake people up also. So if they're not responsive to you tapping them on the shoulder, you can try a sternal rub as well. And hopefully they respond. If they don't respond, then what do? That means they're unresponsive, okay? So you would call 112 at that point. Call 112. If there's somebody else nearby, a bystander, let them know, ask them to call 112. So if you have a mobile phone, hopefully everybody has a mobile phone now. Keep it next to you, okay? Keep it next to your side. If you don't have a mobile phone, you don't have a cell phone, all right, then how are you going to call 112? Well, you have to go somewhere. So at that point, go to wherever you can. You can find somebody on the street or your neighbor, or if it's at a workplace, one of your coworkers, and tell them to call 112 and tell them, or you need to get an AED. Okay, an AED is an automated external defibrillator. Now, if you are by yourself, okay, if you are by yourself, what I just told you, everything to do, you call 112 and you go find an AED and call 112 if you're alone, or you can tell a bystander. Now, if there's no bystander, but the victim is a child or an infant, you don't go call 112 right away. You don't go look for an AED right away. For a child and infant, this is very important, okay? So make sure you understand this. For a child and infant, what you're going to do is you give CPR for 5 cycles. 5 cycles you do CPR, then you go and call 112 and find the AED. Very important. This is only if you're alone. If there's somebody else that's there, you can tell them to call 112 and go find an AED. All right? So this is very extremely important. So make sure you do that. 5 cycles for infant and child. All right. Now you can check for breathing. Okay, 5 to 10 seconds you check for breathing. How do you check for breathing? You see if that person's chest is going up and down. If it's not going up and down, that means they're not breathing. You can also feel to see if there's air coming out of the nose and mouth. If there's no air coming out of the nose and mouth, that means they're not breathing. Right. So these are 2 things that you can do to learn if that person is breathing. Looking to see if the chest is going up and down. Also, you take your ear and you listen and feel to see if you hear them breathing, if you hear air moving in and out of their nose or mouth, and also if you can feel the air moving out of their nose and mouth. Okay, this is how you assess for breathing. The next thing that you look at, if that's not happening, all right, now you know, look, they're not breathing, they're not responding. So again, their heart is not, they need CPR. So you start chest compressions, right? So you want to do CPR on a firm, flat surface whenever it's possible. In other words, if it's on a soft bed, you don't want to do it there. Hopefully you can do it on the floor, a hard floor. You're going to use 2 hands, right? And then this is for adults, okay? For adults, you're going to use 2 hands and you're going to compress. You're going to push down about 5 centimeters. 5 centimeters, you go down. That's about 2 inches. For infants, okay, for a child as well, you can do about 1.5, 2 inches. So about between 4 to 5 centimeters for child. Okay, infants again 3.8 centimeter, about 3.8 centimeters. Talking about 1.5 inches. You take 2 hands. So if you look over here, 2 hands, you push down. Okay, place hands in the center of the chest. So you go to the center of the chest. Now, if you guys remember, between the 3rd and 5th intercostal space, that is where you want to place you position your hand. And what you do is you place the heel of your palm. So let me show you. This is the heel of my palm. Okay, this part is where what needs to be placed over the sternum. This part here, over here. You lock your fingers like that, and you're pushing down. Okay. Now the other thing is you want to push down with the weight of your body. You want to keep your arms straight out. You can see. Don't do this with the elbows, not like that, but straight out. And then you push down. Use the weight of your body to come down on that on the individual. Okay. So keep that in mind. Remember that. Okay. So how many times do you push? How much compressions do you do? This is the question that's asked. So you're going to do about 100 to 120 compressions per minute. Okay, this is the speed, 100 to 120 compressions per minute. This is not the rate. This is the speed, 100 to 120 compressions in a minute. So again, as I told you, is between the third or fourth rib, or between the third and fourth intercostal space. This is where you do the chest compressions. Do not forget that, please. Okay, it's extremely important to know. Then, once you do that, all right, what do? You open up the airway. So you use what's called this head tilt chin lift maneuver. Head tilt chin lift. So you use the head tilt chin lift maneuver. You place one hand on the person's forehead, and you place the fingertips on the of your other hand on the bony part of the chin. Okay, so you go to the mental prominence. So again, you guys are physical therapists. You take an anatomy. You know where the mental prominence is, right? So you go to the underside of that, inferior to the mental prominence, and then you're going to gently push upwards. Okay. You lift the chin up. Okay, it's going to help tilt that person's head back. Why did you do that? To keep it open, to keep the airway nice and straight. So if you look over here again, look at this picture. When the person's head is straight, notice that the trachea, it's slightly closed off. Okay, it's compressed a little bit by the tongue, etc. So in order to keep to make that the trachea and wide open for more air to go in, you place your one hand, you push back on that head, and the forehead, you push downwards, and the chin with your other hand, you lift upwards. So when you do that, again, that's called the head tilt chin lift maneuver. When you do that, the trachea opens up. Okay, more air can easily flow in. Next, you pinch that person's nose shut. Take a normal breath and blow into that person's mouth, okay, for 1 second. Take a breath yourself and give another 1 second breath. So again, 1 second breath, that's what you do. Okay, you can go at least minimum 1 second. Okay, you can do a little bit, 1 long second. Okay, it shouldn't be short. One, not like that, no, but it should be like 1 second. Okay, like that. That's 1 second. You breathe in, right? That's a 1 second breath. So this is what you want to do. Okay, don't forget that. Children is going to be a little bit different. All right. All right. Next. Okay. So an automated external defibrillator. You continue CPR until hopefully you can have access to an automated external defibrillator. You're going to place that on. Okay. And that's going to, it's a different, next chapter we'll go over the AED, but essentially if that person shows signs of life, you can stop. Okay, if they, in other words, if you feel a heartbeat at that point, or again, they start to breathe on their own, then you stop. Or when the ambulance arrives, you can stop. Okay, or again, if you become very tired, you can stop, because you're gonna get tired very fast, quickly. You don't realize that, but you do. So again, this is the only time you stop. Otherwise, you continue CPR. All right, you stop CPR if somebody, a doctor comes over to relieve you, or the ambulance comes to relieve you, or again, the person shows signs of life, you can stop. If not, you continue. Or again, you have an AED. When the AED comes, then you can stop. So after that, then what you do is you look at rescue breathing. Now, how do you do rescue breathing? It's best to have one of these masks. So if you have these masks, they have a one-way valve. So when you do this, you're protecting yourself from that person. In other words, this valve only opens up one way. When you breathe into it, the valve opens for the air to go in. Okay, but if that person were to breathe out, or that gas that's inside their mouth and lungs, in their airway, it won't come into you. So it's there to protect you against that. Also, sometimes somebody might vomit. If they vomit, you have this, then you're gonna get that vomit inside your, on you, inside your mouth. So this is good to use. You don't have to use it, but it's a good practice for safety, and you may not always have this available. So again, adult and child CPR, kind of going over it. First of all, what do? You check for responsiveness. Are you okay? Are you okay? You tap their shoulder, you do a sternal rub. If the adult and child, again, if they don't respond, then what do? Then you will go and activate EMS, right? You call 112, or you tell somebody to go call 112, and or you go find an AED. We have them bring an AED. Okay. Yeah, you do that. Okay. Then you come and you see, are they breathing? Okay, you check for breathing. Is their chest going up and down? If it is, good. That's a good thing. All right. That means they're still breathing. It means they have a heartbeat. Essentially, that's what that means. If not, then again, you're going to start CPR next, right? As we go into the next slide. So in this slide, again, what do? You provide chest compressions afterwards. When do you provide, what do you do? Remember, between the third and fourth rib, or third and fifth intercostal space, this is where you're going to place your arm. You open up the airways and you start giving rescue breaths. So remember, compression-wise, we said up to what? 100, right? 100 compressions per minute. That's the speed. And then we end up giving rescue breaths. How many rescue breaths? 1 second. 2 breaths, 1 second. So when you do 100 compressions and then you give 1 breath, or you'll give 2 breaths, right? 2 rescue breaths. And remember, what are they doing for rescue breath? Head tilt, chin lift. Then you come over here, adult and child CPR. So again, you're going to repeat the compression and breath cycles until you keep doing that. Remember, when did we say we stop doing that? When an AED comes, you can stop, or when the paramedic comes, you can stop. If a doctor comes, you can stop, or you become too tired, you stop. Right? These are the 3 times you stop. Until then, you continue with the CPR. Remember, AED is automated external defibrillator. Now, in the case of an infant, remember, you check for responsiveness. All right. Now, if they don't respond, what do? The child doesn't know, baby, are you okay? Okay. You tap the baby's shoulder, you tickle their feet. If they don't respond, then you do 5 cycles of CPR. Okay. If they don't respond, then you do 5 cycles of CPR. What is 5 cycles? Again, you're going to do that compressions, breath, 2 breaths. That's 1 cycle. Compressions, breath, again, 2 cycles. So every cycle consists of 2 breaths and chest compressions. That's 1 cycle. Okay. All right. So you do that 5 cycles. All right. If they don't, first of all, if they don't respond. So here, let's go over that. This is not in the proper order. Okay. This is not in the proper order. So again, first of all, you're going to check for responsiveness for the infant. If the infant doesn't respond, what do? You want to check for the breathing. Is the baby breathing? Baby's not responding, the baby's not breathing. After that point, you start CPR. You do 5 cycles of CPR. After you do 5 cycles of CPR, then you go and activate EMS. All right? EMS gets activated after 5 cycles. Be sure you remember that. So again, you do the chest compressions, you open up the airway, you do 2 rescue breaths. Okay, so always chest compressions first, then rescue breaths. Now, remember we said when we're doing the rescue breaths for adults, you pinch the nose, head tilt, chin lift. You pinch the nose, and then you give 2 breaths. Your mouth covers their mouth for adults and children. Now, in a child, you can't pinch their nose. So in a child, you have to cover your mouth. You have to cover your mouth over their nose and lips. Over their mouth and nose, you have to use to cover, and then you blow in, because you can't pinch a baby's nose. It's too small, and it's the distance from their nose to their mouth is very little. Then you give the rescue breaths. Now, the rescue breaths for a child, it's shorter than 1 second. Okay, you're going to do a puff instead, because they have very little lungs. So, okay, just a puff like that. Small burst of air. You're going to do 2 bursts like that. Okay, so very important. Next, all right. What about how do you know if there's an obstruction, an airway obstruction? So an obstruction is when something is blocking air to go into the lungs. Okay. If that's not happening, then you have an obstruction. Okay. You might recognize when a person's coughing, right? They don't have good air exchange. When they're forcing themselves to cough, that means that person's probably choking on something. So encourage that person to keep on coughing. So because coughing is going to help bring up that obstruction out of the air, and hopefully they can spit it out. So again, when there's a severe obstruction, you're going to end up having very poor exchange. They're going to have a lot of very hard time breathing. They might, again, you'll probably see them with their hand on their neck, which you'll see in the, so if you look at this photograph, this person's hand is on his neck. This is a universal sign of choking, okay? Universal sign of choking is this. They have their hands on their neck. Again, they can't, they may not even be able to cough, all right? They may not be able to walk either. They can't speak. And if you look at their skin, it's probably turning cyanotic, right? Remember what cyanosis is? Cyanosis is skin turning blue. So you go up to this person and ask them, hey, are you okay? They're not able to talk. They're going to tell you no. They'll nod their head side to side, right? That means they're choking probably. Again, this means this is a universal sign of choking. So at this point, what do? You have to do what's called the Heimlich maneuver, okay? For adult and child, this Heimlich maneuver. And for Heimlich maneuver, you go behind the victim, and you're gonna reach around to their waist, and you put your fist above their belly button, above the umbilicus, above the navel, right? And then you're gonna push in and up. You do compressions, quick thrusts in and up. Okay, this is the direction that you do it. So again, place your fist with the thumb side against that person's abdomen above the umbilicus. All right, that's your hand position. Okay, if you make a fist with one hand, the other hand you go and you wrap it around. So you can see over here, he's wrapped around. The fist is his left hand he has above the umbilicus. Right hand he's holding his other hand with. Then he's going to press into the abdomen quickly, in and upwards, inward and upward thrust. Okay, and he's going to continue this until that object comes out of that person, or you continue it until they choke, spit out whatever is choking, or they become unresponsive. All right. Now, if they become unresponsive, what's going to end up happening is, when they become unresponsive, you lay them down and then you do abdominal thrust. Abdominal thrust. It's the same, just like Heimlich maneuver, but again, you're going to use your heel like you were doing in CPR. You go above the umbilicus and you push in and up also, right? In and up for an unresponsive person. Okay. If a baby under 1 year old, if they are choking, what you do is you take your one hand and you support that infant's head and neck. All right, you support their head and neck. You lay the infant on your thigh, as you see in this picture, and then between the shoulder blades, okay, you're going to give back blows, 5 back blows. Okay, 1, 2, 3, 4, 5. Okay, you do that. After you do 5 back blows, you roll them back. All right, and then you do 5 chest compressions. Chest compressions, you use 2 fingers, and you're going to go about 3.8 centimeters. Okay, that's how deep you go, 3.8 centimeters. Okay, 5 chest compressions on the infant sternum using 2 fingers. Okay, middle of the sternum, that's where you're going to do the compressions, and you repeat this until that that object is removed or that baby becomes unresponsive. Okay, if you're unresponsive, then you start CPR. CPR in an infant is the same exact thing as you see over here. CPR, you take 2 fingers and you push down about 3.8 centimeters, okay? 3.8 centimeters on an infant. The rate is going to be about 120 to 150 times a minute. This is the rate, 120 to 150. That's the rate for an infant. Compressions, much, much, much faster. Okay, so you continue with that. So again, remember, for infant, it's much, much more different than it is for a child or an adult. Now, if that individual who's choking becomes unresponsive, you're going to call 112 right away. Right away, you call 112, you activate the EMS, and you start cardiopulmonary resuscitation. So you're going to start CPR. Try to see if you can find that object in their mouth. Okay, while you're doing CPR, see if you can see the object, and if you can pull it out, you can go ahead and pull it out. Hopefully, they'll cough it up. So this is very important. Again, CPR. Other times that it can happen, person's heart can stop if they have an obstruction in the airway. Remember, the heart will stop if there's not any oxygen going there. Okay, no oxygen going to the heart, that's when it's going to stop. Why can that happen? For many reasons. One of the reasons could be the air is obstructed. Other reasons, again, it could be a lack of blood flowing to the heart because of high cholesterol or, again, atherosclerosis developing plaques within the coronary arteries. Multiple reasons, or it could be an occlusion somewhere else. All right, so these are the reasons for that to occur, for these issues that would necessitate cardiopulmonary resuscitation. And again, choking, in the case of children sometimes, an infant, okay, even a child, they're playing, they do stupid things. Okay, they take something, a toy, and put in their mouth. It becomes, gets stuck, they swallow it by mistake, and it goes into the trachea instead of the stomach. So again, that could be an issue. That can happen. And adults, the vast majority of the time, it's food. They choke on food. So why would they choke on food? For one reason or other, they're eating too fast, or sometimes, again, they're talking and eating. Talking and eating, that's going to end up opening up the trachea. And if you have food in your mouth, that food, if it gets into the trachea, again, you're going to choke. Remember, what's supposed to belong in the trachea? Only air. Only air can go in the trachea, not anything else. No. So if anything other than air goes over there, then we have problems. And again, when that happens, we say that individual is choking. All right. So, do you guys have any questions? Any questions about this? What we've covered so far? Everybody's good? All right, remember, this is a very important chapter. I want you guys to get a very good understanding of this. So remember, essentially, CPR is, what is it? CPR stands for cardiopulmonary resuscitation. Cardiopulmonary resuscitation, CPR. So when a person is not, if they don't have a heart rate, if their heart is not beating, this is when we're going to start cardiopulmonary resuscitation. Rescue breathing also, again, or if they have an obstruction, we say that we also start rescue breathing for them, or we start actually choking here for them. And in adults, we use the Heimlich maneuver to remove that obstruction for them. In an infant, we do the back blows in them to remove that obstruction. Okay, so this is remember, in infants, back blows. In adults, Heimlich maneuver. Okay, Heimlich. So these things, again, you can save a person's life right away. And this could happen in a restaurant. If you're going at a restaurant, now that the restaurants have opened back in Turkey, you see somebody that starts to choke. And again, if you know how to do this, you can go and remove that obstruction and save that person's life. Or it could happen even in your own home. Your brother or sister, maybe your parent. And then as far as CPR goes, look, everybody's going to die, right? And if you're unhealthy, then your chances of heart disease increase. And again, heart disease increase. Now we're talking about heart attack. So, you have a chance of a heart attack if that happens to somebody in your household, God forbid, okay, or again, one of your coworkers. And you know how to do this, you can save their life. This is why it's very important. So again, remember, if you're able to recognize that they're having a heart attack, they're having that medical emergency, a life-threatening emergency, you can activate EMS. That's the first thing. This is the first part of that chain of survival, the first link. The second part is, again, to start high-quality CPR, good CPR. Now, if you have an automated external defibrillator, an AED, if that is available, then you further increase that person's life. We haven't talked about AED. This is in the next chapter, the next unit. We're going to be talking about that. So there's a separate unit for AED, but again, it's tied into this chapter, but a lot more detail. So we just separated the two. So if you have that AED, and in Turkey, some places do and some places don't have it, just like anywhere else in the world, but it is available in Turkey. They have it here as well. The next thing is basic medical services, advanced medical services. In other words, putting that person to an ambulance and transporting them to a hospital. That's the fourth link. And then the last link, the fifth part of that link would be to actually have them at an advanced life support, to have that individual in an advanced life support setting. In other words, we're talking about post-cardiac arrest care, the patient receiving post-cardiac arrest care. So if you have these things, again, you're going to drastically increase their chance of survival. Right? So these are very important things. If you have these things, then again, you can save that person's life. And then remember, the chest compressions. Remember, do not forget what the age groups are. Remember, adults, anybody over puberty. Okay, puberty and older, that's what that adult is. For child, remember what we said, up to puberty, from age 1 up to puberty, we call them a child. Right? And remember, this is important because of how deep you're going to do the compressions and also the rate. This is why you need to be able to understand the age groups. And then infant, remember we said, is anyone that's under 1 year old, under 1 year old. So again, I'm going over this, I'm stressing to you because these are very important things to be able to recognize the difference in age. Because again, when you're looking at rate, in this case, remember for child and adults, you go down about 5 centimeters, okay, 5 centimeters. All right, this is how much you're gonna, this is how deep you do the compressions at. And remember, for an infant, it's less than that. It is 1.5 inches or about 3.8 centimeters. This is how much you compress the chest. Okay, if you're not doing that, then there's issues. You're gonna have a problem. So do not forget about that. Very important in terms of how much you compress. What else is there? So yeah, these things are extremely important. This knowledge to have, the amount of compression that you do, the distance, how much force, in other words, to go down. And remember, in terms of hand placement, palm placement, it's the palm of your hand that goes over between the third and fourth intercostal space that you go over. So you should know where that is. You should be able to palpate and understand that. And then remember, head tilt, chin lift. Head tilt, chin lift. Why do we do this? We do this to straighten up the airway. Okay, this is the purpose for head tilt, chin lift. And once you do that, then it is much, the air can move in and out much more efficiently, effectively. Okay. After that, remember we talked about rescue breaths, and for rescue breathing, remember when you're going to give that breath for adults and children, you pinch their nose. You pinch their nose. When you pinch their nose, then remember it is a 1 second breath. Okay, that's a 1 second breath. You take a deep breath in, and you breathe out. Remember, for a child, okay, a child, it's the same thing. 1 second breath. However, for an infant, it is not a 1 second breath. Infant, it is what? Remember what I said? It's a puff, a quick puff. Okay, puffs. That's what you're going. You're puffing air. And again, when you're doing that, when you're doing the breathing, look to make sure that the chest is going up. So when you breathe into their mouth, you see the chest rise. If the chest does not rise, reposition their head. Do the head tilt, chin lift maneuver again. Okay, and then it'll rise. If the chest does not rise, that means maybe you're not pinching the nose, or that there is an obstruction. All right. So again, make sure the nose is pinched, and also make sure the head is tilted and the chin is lifted properly. Make sure the tongue hasn't fallen back, and then again you can try again. right? And the air should go in. If you don't see the chest rising, that means the air is not going in. That means I have an obstruction. If they have an obstruction, then you do what? If the person is unresponsive, you do the abdominal thrust. Okay, you do abdominal thrust in an unresponsive person. Okay, this is the cause for them not breathing and why their heart stopped, because there is an obstruction. So make sure you're able to recognize that. That's the other thing, recognizing what is wrong. Why is the air not going in? Why? So again, how do you figure out if the air is going in? You look at the chest going up and the chest coming down, right? Um, and remember, you don't stop CPR. You continue until the ambulance comes. You don't stop. Or until somebody that has more experience than you don't stop. Or when the AED comes, the automated external defibrillator comes, you can stop at that point. Okay. Uh, the only other time you can stop is when you get too tired. If you're extremely tired, you're fatigued, then you stop. You don't want to pass out yourself. You don't want to become unconscious. All right. So at that point, you can stop if you get exhausted. So again, these things are important for that. And in terms of these barrier devices, so these are called barrier devices. So there's mouth-to-mouth breathing mask, a mouth to mask breathing. There's also these mouth-to-face shield breathing. This is a face shield that covers the person's face as well as their mouth. It's just plastic essentially. Again, this is a one-way valve. You can blow in the valve that's over here. It opens downwards, but it doesn't open upwards. It doesn't open towards you. So again, the air will just go in one direction from your mouth into that person's mouth. That's how that would work. Okay. So again, do you need that? No, you don't need that. If you have it, wonderful. If not, it's not the end of the world. It's better to have, but not necessary. We'll keep it like that. Remember, how do you activate EMS? In Turkey, you call 112. Okay, and if you're in another country, I don't know, you should have your own number to call. And in the United States, it's 911. Okay, that's why this number is used. If you're in the UK, there's another number. So every place, they have their own EMS number that you dial to activate the service, again, emergency medical services. So again, they're showing you over here the chest, the hand placement, and then they're doing compressions and rescue breathing. We talked about the rate for rescue breathing also. So make sure you're cognizant of that. You recognize what the rates are. Remember, 2 breaths you do, and then you do the compression, the compressions. Chest compressions. Remember, 100 compressions, 100 to 120 compressions in a minute. In infants, it's over 150, at least 150. That's the minimum that you're going to be doing, right? Babies, you need to move. Again, their heart is smaller, the lungs are smaller. So because the lung is smaller and the heart is smaller, it has to work harder to circulate that oxygen. This is why it beats much faster. As they get older, when they become older, then the lungs grow, lung size increases, heart size also increases, efficiency increases. Efficiency increases, the rate decreases for both breathing as well as uh, cardiac contractions. Yeah, the heart rate will also decrease. What else is there? Yeah, okay. So rescue breaths. We talked about the person. We talked about the rate. 2 breaths. Remember, 1 second puff in adult and child. 1 second breath in adult and child, and quick puffs, bursts, short bursts of air in infants. Okay. So this is what is important. Anything else? What else? AED. So we're going to be talking about AED next. We'll go into detail about that. Obstructions, again, you ask them if they're choking. This is called the universal, again, this is the universal sign of choking. Universal sign of choking, universal sign of distress, obstruction distress, when they have their hands at their necks, okay? And again, you can see their face is red, or they'll turn pale, they'll turn cyanotic. All right, let's take a short break and we'll continue in a little bit when you come back. All right, guys. So now let's get started with the chapter on the AED, okay, the automated external defibrillator. Okay, that's what AED stands for. So a person's chance of survival, it dramatically increases. So again, if they get early CPR, if they get early defibrillation, okay, in other words, if there's early use of an AED, then their chances of survival increases dramatically. Marve, can you mute your microphone, please? Okay. Uh, so, what else is there? All right. Public access defibrillation. All right. So AED, it must be used in the first few minutes in order to be effective. Okay, it should be used right away. AEDs are available in public places, many public places, AEDs are available. So if you go and look at, for example, at a mall, it is available. A lot of the malls, they have it. A lot of the big apartment buildings have it. Even a lot of office spaces, they have it. Hospitals, of course, they will have, they probably have it located at various places. In the clinics, they may have it. In the United States, it's very common to find them nearly everywhere, even at grocery stores, at shopping malls, at shopping centers. They have them available. Nearly every store has an AED. That's how common it is in the United States. In Turkey, it's not as common, but again, it is available here. Um, when you use this, again, you can greatly increase that person's life. So very quickly, again, when you think about heart, we kind of reviewed this in the last week in terms of heart and how the heart works. So remember that heart is an organ. It's a hollow organ with four chambers. Again, two chambers on top, two on the bottom. In other words, the atria and the ventricles. So again, it has its own electrical system that contracts approximately once a second, a little bit shorter than that, but again, at least once a second. In other words, 60 beats a minute possible. And essentially, the blood is moving from the right side to the left side. Okay, in other words, you're getting deoxygenated blood on the right side. Remember, the right side of the heart, we say, is a pulmonary circuit because the blood is being sent, deoxygenated blood is being sent to the lungs. And the right side, we say, is a systemic circuit because it is pumping oxygenated blood to your entire system, to your entire body, including the heart itself. So between the right and left, we have the lungs. Between the right side and the left side, the blood gets sent to the lungs. In other words, the blood comes on the right side of the heart. From the right side, it gets sent to the lungs, and then from the lungs, after the gas exchange takes place, in other words, carbon dioxide is unloaded and oxygen is loaded uh, in blood, then it is returned back to the left side of the heart. Okay. Moving along with that, again, we look at the most common arrhythmia. Okay. Arrhythmia is not a normal rhythm, without a rhythm, good rhythm. Or now we shouldn't say arrhythmia, dysrhythmia, okay, would be this ventricular fibrillation or VFib, we call it VFib, VFib or ventricular fibrillation. This is the most common abnormal heart rhythm in cases of sudden cardiac arrest in adults. In other words, when the heart is fibrillating, it's just kind of, it's not beating in a coordinated fashion. So you'll see on the ECG strip something that looks like that. And again, what ends up happening is because the oxygen, the heart is not pumping blood properly, the amount of oxygen that's circulating in the system, it's severely decreases. So blood is not being moved throughout the body properly. It's not going to the brain properly either. So now the body's organs, they're not receiving oxygen properly. And then you faint, you pass out. Okay, you go into, you become unconscious, essentially. It's a life-threatening condition. So other times is also something called ventricular tachycardia. Again, this is when the ventricles are contracting fast, but there is some uh, it's able to pump. Okay, all right, it is pumping something, but again, it's not. Same thing is it's not pumping effectively. This is bad, but this is the one before that is much worse. The ventricular fibrillation is much worse than ventricular tachycardia. Then when you look over here, so the case for cardiac arrest, all right, so time is crucial. CPR is the initial care that you do. So when you look at the percentage of survival, right, minutes without oxygen. Okay, so again, the longer you go without oxygen, your chance of survival decreases. So if without after 4 minutes, now the chance of survival starts to decrease a lot. After 8 minutes, 9 minutes, you don't have much of a chance. After 3 minutes, you have more than 75% chance, more than 90% chance of survival after 3 minutes. But when you look at it after 6 minutes, 6 minutes without oxygen, your chance of survival are less than 50, are at 50%, maximum 50%. So again, oxygen is critical. So this AED, this automated external defibrillator, it is an electronic device. And again, it's able to analyze the heart's rhythm. This is its feature. It can analyze the heart's rhythm, and then it delivers an electric shock only if it's necessary. So it determines what the rhythm is, and if that heart's rhythm, if it is not sufficient, insufficient heart rate, then it will deliver an electric shock. Okay. So it's going to correct one of the abnormal electrical disturbances. That's the benefit of that. So AED, you're going to attach to that person's chest. Right? That's what ends up happening. The built-in rhythm, the built-in system, the computer, the chip, and the software, it's able to analyze the heart rate. It's going to record that person's heart rhythm, and then if it's needed, then it's going to send a shock to the heart, okay, to try and correct that defibrillation, and it's going to that defibrillation is going to try to correct the dysrhythmia, or if there's an arrhythmia, it's going to try to give a shock to bring a beat back to that individual. So let's look at some of the common elements that you have in an AED. First of all, they all have an on switch and on and off switch. There's cables that are attached to pads, and the pads, they have pictures on them that show where to place them. It has another unit that has the ability to analyze, and also that unit, it has the ability to defibrillate. The software, it tells you what to do. It prompts you to place the pads. It prompts you to remove your hands. It prompts you to push a button to defibrillate. These are battery operated devices. So that's the good thing about it, is that you don't have to plug it in. You have to charge it every so often. And once that charge is maintained, they're able to operate effectively. So you only use this if the person is unresponsive and not breathing. This is the only time this AED is used, if they are unresponsive and not breathing. Okay, so what do? When you have this AED, you power it on, turn on the AED. After you turn it on, you expose that person's chest. Right? You look at their chest. After you look at their chest, then you apply the pads to that person's chest. Right now, once the pads are applied to their chest, you want to stand clear. In other words, you don't want to touch them, because you need to give that the AED time to analyze the rhythm. And then the AED will tell you, start CPR. It'll prompt you to start compressions. It'll tell you, do compressions. So then you perform the CPR, and you just keep listening to what the device is saying. So sometimes it'll tell you, stop compressions. All right. So, and then it'll analyze. When you stop compressions, it'll analyze the heart rhythm, and it'll tell you shock is needed. Okay, ready to shock, push button. Then you push the button to shock. So this is what's important. All right, so what are some of the special considerations? Now, if that person is wet, if there's water, you have to remove that person from that water. In other words, you have to dry that person's chest. Right? Why? Otherwise, you're in danger of, they can get burned also. The current's not going to work effectively. Right? It needs to be on that dry chest. Now, for children, they have smaller pads that are used. Okay, for children and infants, there might be smaller pads, so you have to use for them. Adults are larger, children smaller. The other thing is, if that person has any medical patches, you should remove them. And the most common is a nitroglycerin patch. If you have a nitroglycerin patch, you have to remove it before you attach the AED. Otherwise, you can have a fire. Okay? It can explode. So make sure you have that that's present. Okay. So other times you wanna the other thing you want to consider is if they have an implanted device. An implanted device, we're talking about a pacemaker, right, or defibrillators. So again, you want to avoid placing the electrode pads over these devices. So again, why? Because it's going to interfere with that. You won't get a proper reading, and also it won't deliver the proper um, current that needs to be delivered. So again, don't place the pads over the device. You want to place it away from the device. Yeah, so um, the AEDs, they should be inspected periodically. Make sure that they're in working condition. Make sure the batteries charged. So we can do test runs on them also. This is the importance of maintenance. In other words, talking about maintenance. AED should be maintained. Now, what about supplies? So inside supplies for the AEDs, the bags that they have, there's going to be 2 sets of electrode pads. There might also be an extra battery, and also it could be a razor. So in some cases, why is a razor needed? Well, when you look at this picture, this person's chest, it's not hairy. Some people have a lot of hair. They look like a bear, that much hair. So again, if they have so much hair, then you have to shave that chest down before you can put this electrode on. Because on hair, this will not stick. Okay, or if you do put it on there, it's going to burn, and you don't want to burn that person's hair and cause a fire or anything. So that's important to have there also. A razor to shave chest hair. There should be a towel present, also a hand towel. Why? Remember we said it needs to be dry. That person has to be dry. You can't have wet over there. There should be, hopefully there's a breathing device. So we talked about the rescue masks, right? So that might be there, or there might even be a pump that you can use also, an air pump. An AMBU bag, it's called AMBU, AMBU bag, to give oxygen to that person. And of course, there's going to be gloves over there, hand gloves. Why? Because remember, we said last time, universal precautions. What is the number one universal precaution? We said they are gloves. Gloves are the main universal precaution uh, device that we can wear to protect ourselves and also to protect the patient from diseases, okay, transmittable diseases. Okay, so these AE devices and their related supplies are available from different manufacturers. A lot of different companies make them. I have no idea if there's a local company in Turkey that built some. I wouldn't be surprised if they do. So again, you can look into that if you want. All right, so that's it for this lecture. It's a short one, so you can stop this one, and then we will continue with one more for today, which is going to be on, let's see, it is on shock, I believe. Okay, I believe that one's on shock. Unit 7 is on shock and trauma. So let's go over this one. So as far as shock goes, shock essentially is inadequate perfusion. Okay, inadequate perfusion is what shock is. So if you have adequate blood and oxygen that are being provided to all the cells of the body, that's good. You have good perfusion, okay, normal perfusion, or euperfusion is called euperfusion, good perfusion. Hypoperfusion, this is when the cardiovascular system fails, okay? Blood circulation eventually stops, okay, and you enter circulatory collapse. That's what that is. When we go into what are the causes of death? Okay, the consequences of death, it's death, brain death. 4 to 6 minutes without oxygen, the brains will start to die, and it's irreversible death. Your abdominal organs, they start to become damaged at between 45 to 90 minutes without oxygen and blood, okay? Your skin and muscle cells, they can live much longer, anywhere from 3 to 6 hours. But again, the main organs would be brain and also heart. Without 4 to 6 minutes, irreversible damage results. So we have what's called this perfusion triangle. In the perfusion triangle, think of the circulatory system as having 3 parts, 3 components, okay, to the circulatory system, or a pyramid. And these 3 components are heart, which is the pump, the blood vessels, which are the pipes, and blood, which is that's the fluid part that's flowing within those pipes, that's powered by that pump. So when you look over here in this diagram, this is what's showing you. So shock essentially occurs when one or more of these components are not functioning properly. Shock can occur when the blood vessel does not function properly, or when the blood is not sufficient in quantity for whatever reason, shock can occur. And also, if the heart is not able to function properly, shock can occur. So again, when you look at causes of shock, okay, so pump failure refers to as cardiogenic shock. Cardiogenic shock is a condition in which your heart suddenly can't pump enough blood to meet your body's need. This condition is it's often it's caused by a severe heart attack, but not everyone who has a heart attack has cardiogenic shock. Uh, Cardiogenic shock, generally speaking, it's rare, but when it does happen, if it's not treated, it ends up being fatal. Okay? So it needs immediate treatment. Other health problems that can also lead to cardiogenic shock. So again, heart failure, chest injury, side effects from medicine. Um, all these can lead to cardiogenic shock. Okay? Or again, there could be a blood clot in the lungs that can lead to cardiogenic shock. The other cause is loss of fluid or blood. Okay, and we call that hypovolemic shock or hemorrhagic shock. Hemorrhagic means bleeding. Hypovolemic, low volume. Hypovolemic or hemorrhagic shock can also lead to that. It's another cause for shock. And again, so hemorrhagic shock, we're talking about when the body begins to shut down due to large amounts of blood loss. Okay, large amounts of blood loss, that's hemorrhagic shock. And again, a lot of times people, they suffer injuries that involve heavy bleeding. When that happens, it can cause them to enter into hemorrhagic shock if the bleeding isn't stopped immediately, again, for large bleeds. So again, some of the common causes of hemorrhagic shock: deep cuts, even burns, severe burns, and deep shock. These are causes for hemorrhagic shock. When you look at poor vessel function, again, that's the blood vessels, they're not functioning properly. That's one of the causes also. Or there could be a damage in the blood vessel. There could be a leak in them. That's another cause for um, poor vessel function. Neurogenic shock is a disruptive type of shock that results in low blood pressure. Okay, neurogenic shock. And again, occasionally this is with it comes with a slow heart rate. And again, it's attributed to the disruption of the autonomic pathways within the spinal cord. This could happen after there's damage to the CNS. For example, in the case of a spinal cord injury, or it can also be when there's brain injury, traumatic brain injury. So again, there's septic shock also. Septic shock, this is a severe and potentially fatal condition that occurs when sepsis leads to life-threatening low blood pressure. Okay, so again, sepsis develops when the body has an overwhelming response to infection. That's sepsis. There's poisoning. So again, when chemicals that are fighting infections by triggering inflammatory reactions, they get released into the bloodstream. So doctors, they've identified at least 3 stages of sepsis. So sepsis is when the infection reaches the bloodstream and causes inflammation in the body. Severe sepsis is when infection is severe enough that it affects the functions of your organs, like heart, brain, and kidneys. And again, septic shock is when you experience a drop in blood pressure that can lead to respiratory or heart failure or a stroke, okay, or even failure of other organs. And then, of course, it leads to death. Non-cardiovascular, okay, cause of shock, it could be a chest injury, okay, or an airway obstruction. It could be anaphylactic shock as well. So anaphylactic shock, this is you have a very severe allergy to food, medicine, or maybe an insect that comes and stings you, okay, to a bee, a venom. There's also psychogenic shock. Okay, psychogenic shock causes fainting, okay, probably by initiating dilation of blood vessels that perfuse the muscles. In this type of shock, blood pressure falls, the skin becomes cold, it becomes clammy or sweaty, and pulse rate, your heart rate also increases. Um, a decrease in the amount of blood that's supplied to the brain leads to lightheadedness and loss of consciousness. Now, fainting or syncope causes include fear, bad news. It could be just looking at something unpleasant. All these can be a cause for that. So let's talk about progression of shock. So compensated shock. So compensated shock, this is a category of shock that occurs early when the body is still able to compensate for shortfall in one or more of a few areas of perfusion. Now, uncompensated shock, this is a category of shock that occurs when the compensatory mechanisms fail, okay? And now the patient's condition starts to deteriorate. And this is uncompensated shock, right? Okay, so remember, compensated shock, your body is still trying to do something about it. Uncompensated, it can't, it's failed. Then there's irreversible. This is a terminal category of shock, okay? Terminal category of shock that will lead to the patient's death because it can't be reversed. Irreversible shock, the person's gonna die. You can't stop it, you can't undo what's done. Now, what do you look for in terms of shock? What are some of the things to look for? So mental status, you look for mental status. An altered mental status. They don't know where they're at, who they are, what time is it, what day it is. They don't know anything about that. They don't know what's going on. They're confused. You look at their skin. The skin, it could be cold. It may be pale. It may be clammy skin. So you look at the skin. You look at so skin, and then you can also look at the color of the skin. Is it cyanotic? Okay. What about the nail beds? When you push down on the nail beds, how's the perfusion? What's the capillary refill? Vitals, right? So heart rate is going to be altered. Respirations are going to be altered. And again, they may be unresponsive when the shock is severe. They could be unresponsive. So what do you do when the person is shocked? How do you treat them? All right, so first of all, you want to treat the injuries. If they're responsive and they're breathing normally, keep that person flat on their back. If there's no sign of injury, raise that person's feet about, look, this is like maybe, yeah, one box, paper box. This is maybe about the size of a shoe, of a man's shoe, about 12 inches size, so about 48 millimeters roughly, that much. Yeah, 48, 50 centimeters, sorry about that. This is the size you can elevate for them. Now, what do you do? So if they're unresponsive, you want to roll that person onto his or her side. Remember what this is called? We learned about it in the last lecture. This is called the recovery position. So you have them in the recovery position. Why? Because you don't want them to choke. Again, try to keep them warm so they don't lose body heat. If there's a blanket, try to cover them up. Call 112 if you want to activate EMS. All right, don't give them anything to eat. Do not give them anything to drink. Now, what do you look for in cases of anaphylaxis? Again, shortness of breath. Do they have shortness of breath? How about their tongue? Is it swollen? Or is their mouth swollen? Is their nose swollen? What about their skin? Is their skin flushed? Right? Do they have flushed skin or swollen face? What about pruritus? Okay, do you see a lot of bumps on their skin? Wheals? Are those wheals present on the skin? Are they sneezing? Are they coughing? Any tightness and swelling in the throat? These are all things you want to observe and look for. Tightness in the chest. Are they complaining of that? And these are signs also. So again, increased heart rate, cyanosis, dizziness. Do they have a history of any previous severe anaphylactic or again allergic reactions? Do they have any medical identification tags that may give you a clue as to what their medical condition is? Okay, their past medical history. All these things you wanna look at. So again, what do? 112. You call EMS. You activate EMS. You want to monitor the breathing. If that person's having an allergic reaction And sometimes a lot of people that have known allergies, they may have what's called an epinephrine injection pen. So if they have this or in short, it's called an EpiPen. If they have this EpiPen, you want to help them administer to themselves. Okay. If the person is able to swallow, if they're having an allergic reaction, if they have anaphylaxis, then you can give them an antihistamine, like a Benadryl, for example, diphenhydramine. You can administer that. So if you look over here, this is an example of an EpiPen using an epinephrine autoinjector. So you find the injection site. Where do you want to inject this? It's going to be in the outer thigh, the middle of their outer thigh. You move the cap from this. After you remove the cap, you just take it and you stick it. You push it, and then a dose of epinephrine gets injected. You don't have to take off the clothes. So again, you push against the mid thigh and you hold it. Push. You hold it for 10 seconds. That's it. You pull the injector straight out from the leg after that 10 seconds, and then you rub the area for 10 seconds. So 10 seconds, take the cap off, you find the site, take off the cap, you push it against their thigh and you hold for 10 seconds. You remove it, and then you rub the area for 10 seconds, you massage it. So for mild allergic reactions, their eyes may be red, it may be itchy, they might be sneezing, they might have a runny nose, they may have wheals, rashes, pruritus on their skin. These are things to look for minor anaphylaxis, minor allergic reactions. Mild reactions, again, self-administer their inhaler. So if they have an inhaler, give them that. Give them an antihistamine. If they have medication, you want to give that to them, okay, to help them. Now, if that person suddenly collapses, what do you do? Again, ABCs. ABCs, airway, breathing, circulation. Airway, breathing, circulation. That's the ABC. In other words, check their breathing. Make sure they have an open airway. Make sure there's no obstruction. Make sure they're breathing, and make sure they have a heart rate. Okay. If the breathing stops, you call 112 and you start CPR. Right. So if that person is breathing, keep them flat on their back. Monitor the breathing. If it stops, give CPR. Okay, and check and treat for any injuries they may have. If you have a wet cloth, wipe their head with the wet cloth, again, to control temperature. Right. If that person is about to faint, right, you want to prevent them from falling. So what do you want to do? You want to lie them down or sit them down so they don't hit their head. Do not place your head between your knees. Don't have them place their head between their knees. That's not good. So again, just have them lay down and again, immobilize them. Don't let them moving around, standing around. All right, so that is it for this chapter. Does anybody have any questions? Anybody, any questions about what we discussed today? Stop recording.